Dr. Besser, thank you very much for joining us today. Where are we right now in terms of this virus?
Well, Katie, the maps you show that are getting to be read in just about every state tell a very scary picture. This is the most dangerous period we've yet seen in this pandemic. And if you think back to the spring, with hospitals overwhelmed in isolated places, imagine what that's going to be like when you have hospitals overwhelmed in just about every state, when it's impossible to see healthcare workers moving from, between states to try and provide some of that support. And we know the way forward. One of the most tragic things right now is we know what needs to be done to get this under control. There are things we need to do as individuals, even though we're tired of doing it. We need to wear masks. We need to keep apart. We need to wash our hands. But if Congress doesn't step up and put money in people's pockets, one of your correspondents hit this beautifully. If you don't put money in people's pockets, then you can't expect people to do the things that need to be done. And that means stay home if you're sick. Stay away from other people if you've been exposed. How is someone going to do that if they're having to choose between, going to work so they can put food on the table and pay the rent, or staying home so they can help spread the infection? No one should have to make that choice. But in America today, millions of people have to.
Yeah, this is one of the major differences between how we are responding to the virus and how Europe is responding to the virus. In Europe, the people who need the money are getting that money. In Greece, notably, if you need extra help, you are getting that extra help in a country like Greece. But here, you're linking the two. You can't be forced to stay home. If you're forced to stay home and you can't make money and you can't pay the bills, you can't feed your children, it's an impossible situation. So until we get that under control, until Congress acts, and they just went on recess a day early, you're saying that the expectation is people aren't going to be taking the measures that they need to take, and this virus is going to get worse.
That's right. And in addition, we see resistance from small businesses to shutting down, even if they're involved. And that's because they're being forced to choose between shutting down and going out of business and maybe never coming back and doing the right thing. If Congress would step up and provide resources, put money back into the payroll protection plan so that small businesses can stay afloat and shut down during this period, we would go far. I mean, those are the things we know what needs to happen. But if we don't do that, if we just look to the future when there's going to be a vaccine, we are going to see tens of thousands of people die this winter. Large proportions are people of color, Black and Latino and Native Americans, but so many communities that will be devastated by this that don't have to be if Congress would do the right thing.
Dr. Besser, quickly, because we're about to get a report from New York on schools, a 3% threshold for closing schools. What do you think of that?
Well, I think when it was set up, it was a good thing because we were concerned that anything above 3% would mean there would be a lot of spread through schools. But what we've seen in New York and other communities is that you can do this safely. You can put children in a classroom and ensure that they're wearing masks and keeping away from each other. And you can do all of those things that are so important to keep teachers safe, to keep staff safe, and not see spread in the community. You have to go with the public health science. And if schools have been open safely, keep them open, continue to support and protect your teachers and staff, but don't shut them down as a reflex. Follow the data, follow the public health.
The public health science has changed since that decision was made on that 3% threshold. Dr. Richard Besser, thank you so much for joining us today. We always appreciate your expertise.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.